COVID-19 cases surging, so is the struggle for healthcare workers treating them. According to CNN, at least 56 intensive care units in Florida hospitals reach capacity as of Tuesday. Another 35 hospitals show ICU bed availability of 10% or less. CBS 4's Joe Murray continues our team coverage on this from Weston.
It's an emergency with no clear outcome. Hospital beds filling up in South Florida as COVID cases skyrocket.
The occupancy of all the health systems throughout South Florida is very variable. We hear that hospitals in Dade County are a little bit busier than the ones in Broward.
Dr. Rodolfo Blandon with Cleveland Clinic Weston said they are at 90% capacity, but the patients are different from the start of the pandemic.
They are in the hospital less than before, and also we are seeing the need for less ventilators, and the mortality rate locally has also improved.
Still, Cleveland Clinic is making a backup plan, looking for more bed space, bringing in medical staff from outside, and shifting elective procedures to an ambulatory care center.
Clearly, we're very concerned, and we monitor the number of new cases on a daily basis because we know that about 2 weeks from that day, they might need to come into the hospital.
They're watching the numbers at Broward Health, which still has beds available, and at Memorial Healthcare, they're also looking at additional bed space.
We're approaching that level, in other facilities, I'm hearing that, that they don't have enough space,
Tony Baldy is a critical care nurse at Northwest Medical Center, Coral Springs. Her concerns go beyond capacity.
On a daily basis, I'm worried about not being able, running out of PPE with the amount of patients that we're seeing. If I catch a virus from working in my profession and giving it to my family, I think would be very traumatizing to me.
We have gone from 38 ICU level of care beds in my hospital just a few months ago. We now are up to 52.
Jackson South's Dr. Andrew Prashesky had the virus along with his family and says patients dying still had a lot of life to live.
These are 80-year-olds that contracted a virus because a group of people just didn't want to wear a mask and they had to go out and have fun. And it really upsets me when everybody says it's just old people and it's not a big deal. I had a mom and grandmother drive themselves into my hospital, and only one drove home.
With the COVID numbers continuing to go in the wrong direction, hospitals are doing what they can to free up space, preparing for the next big emergency. In Weston, Joan Murray, CBS 4 News.